Hi everyone, my name is Frimpong. I'm a physician and a master's student from at University of California, Berkeley, with focus in epidemiology and biostatistics. So this summer I had the opportunity of joining the UCGHI Planetary Health Fellowship, where I work with Dr. Laji Sanga from UC Agriculture and Natural Resources on a project that was looking at nitrate contamination in drinking water in California Central Valley. So with this experience, it really changed the way I think about public health, coming from a minoritized group, underrepresented group. I've spent quite some number of years treating patients that come with diseases that are often shaped by where people live and this fellowship actually helped me to see the same patterns of inequality existing here in California Central Valley. So here you can see a Californian woman using bottled water instead of drinking tap water because of suspected poisoning. So working on groundwater contamination showed me how deeply environmental health are connected. It wasn't just about the numbers or the maps, but it was really about real families who may not have access to safe drinking water and whose drinking water is being polluted with all forms of chemicals, from lead, copper, nitrates, etc. So that realization made the project proposal very personal to me. So especially using geospatial mapping and also using interactive map to make some beautiful visuals. One thing I also learned was that use data as a tool for justice. So before this summer, I was having very little experience in spatial data analysis, but by learning how to use the mapping tools and data vision, I could actually show how contamination disproportionately affect disadvantaged communities. So I feel like that felt really good to use science to make invisible problems become very visible. So these are some of the maps that's showing the nitrate contamination around the Ken and the Tulare, and also the multi-chemical contamination patterns, and some maps that are visualizing what you will be seeing like around these communities and the affected places and the non-affected places. So what was the most valuable reflection to me was seeing how research can just move beyond the classroom or working in a remote setting and making a real impact in the community and outside. So I had the opportunity of interviewing or being on Zoom meetings with these farm workers and people living in the community to also listen to their opinions and also know about policy decisions that are being made in shaping how some of these things happen. So this experience has actually strengthened my commitment to working at the intersection of public health, environment, and equity, and it has also taught me about public health being a health professional means to studying problems and also helping to solve them. So I really appreciate this opportunity to be part of this fellowship, and I've really learned a lot, and thanks to everyone and the team involved. Thank you.